welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Gladwell Dental.
And this episode sure has some bite.
My goodness, but that's right. We are talking about the ever-important bite registration stage. So Dr. Chi is going to talk today about communication with his patient to make sure they bite properly, we acquire the correct data, and the upper and lower arch meshes together.
That's right. And in that, he's addressing periodontal ligament compression as well as managing local anesthetic.
That's a mouthful.
It is, but I got it out, so let's go.
So now on to the bite registration. You've captured the prep side, the opposing side. How do we bring those models together and articulate it digitally so that we can accurately establish our patient's occlusion? So making sure that we go through the correct steps before scanning the bite, and then making sure you scan the bite at the right time and in the patient in the correct centric position will ensure that you have an accurate fitting restoration and occlusion. If the bite is off in any way, if the patient's bite is slightly open, that would lead to very high restoration. And certainly we want to avoid that because there would be a lot of adjusting when the restoration's back and tried in on our patient. So let's review some steps and tips on how to ensure that we can scan the patient's bite accurately for that precise fitting occlusion. Let's take a look. So you've captured the preparation area, the prep quadrant, the opposing. Now it's how do we bring those together with an accurate bite registration? So whenever we take a digital bite registration, we capture the buccal surfaces of the patient's teeth when they're biting together. And then the system will use that position to digitally articulate those digital models. Now, we do want to capture those accurately. If the patient's slightly open during the scan, that certainly will throw off the accuracy of the restoration for that area. So again, if they're slightly open, your restoration is going to come out high, which would lead to more adjustments on your end. So we want to make sure that we can design the restorations in the most accurate way by knowing what the true occlusion is for your patient. Now we have our digital model. So we first want to ensure that on the quadrant model of the prep, in this case it's the lower, and the quadrant model of the opposing, that you have a lot of data of the adjacent teeth, of most of the teeth that you're scanning or around the area that you're working on, so that the system can visualize and match those same data points during the bite registration scan. So what that means is you have a lot of buccal information. You want to also have at least the buccal or the gingival margins on the buccal side, because that's what the software is going to use to create that alignment to this model during the buccal scan. So we have that on the lower all the way to the canine, and we try to establish the same thing on the opposing scan. So here we have the upper right scan. We have all the way to the last tooth, number 2, and I like to scan the entire quadrant to the cuspids or canines, in this case to number 6 forward on the mesial. So we have a lot of information for the system to use to create that alignment. So now for the patient, whenever we take the scan or whenever we establish the bite, we want to first ensure that they understand how to bite correctly, because a lot of times what happens is the patient may bite down on just the incisal edges toward the front, edge to edge bite, and that would leave the posterior open, or they're just slightly open. So we want to practice that beforehand, before we take the scan. So asking the patient to close together, perfect, and then making sure that you do have that accurate centric position for the patient. Open again, and bite together, and bite with a little bit of pressure. And of course, it's easier when the patient is more dentate, but if there are more edentulous, it could certainly be a little more challenging. So you want to practice that with the patient beforehand. Ensure that you can accurately create that position during the scan, because especially if they're even anesthetized, that could also impact their sensation on whether or not they're biting together correctly. So it's important that we guide the patient and we capture the scan in that correct position. All right, so let's go to the bite section. So you can see on this scanner with the iTero, when we select bite, we have a visualization of the upper quadrant scan, the lower quadrant scan, and for this scan, what it's going to do is just merge those together. So usually when the patient's biting together, we may not have access to that area. So we'll first ask the patient to open. Go ahead and open all the way. Perfect. And then we position the scanner against the cheek and now bite all the way down together like we did earlier. So we get them back into that same position that we practiced with. And now I'll take it a step further and now bite down with pressure. So we ask the patient to bite down and just kind of clench together, and that just allows the PDL to compress. It really ensures that we have the teeth in the most centric position. Once they're in that position and the camera's in position, now I'll activate the camera. So I activate the camera here with the activation on the iTero is on the scanner itself. Activate the camera and begin capturing information on the buccal surfaces on both the upper and lower. And you can see once the software recognizes enough data from the upper and lower teeth, it just brings those together. And I'll take some additional rotations actually. I want to try to actually capture some of the upper occlusal surfaces around those cusp tips just to give the system even more data points to lock those models together. Because I scan from the posterior, or we try to capture from the posterior, most posterior tooth to the cuspid on both the upper and lower, even if we're working, if the restorative prep is the most posterior or last tooth, by having more data toward the mesial during this buccal scan, it will allow the system to accurately bring those together. It just has more data points to reference. So that's how we establish an accurate bite, and that should hopefully lead to a successful and great fitting restoration with minimal occlusal adjustments.
Thank you so much for that, Dr. Chi.
And if you missed any of the episodes in this exciting series, you can, of course, go to chairsidelive.com, pop some popcorn, and binge watch all the episodes to get the full scoop.
Oh, I'm all about binge watching.
I love it. But for today's episode, we're all wrapped up. So thank you so much for watching.
We'll meet you right back here next time.